A mechanical sound wave enters the human ear, strikes the cochlea, and instantly ignites a rapid electrochemical pulse. The cochlea is the spiral cavity of the inner ear that translates acoustic vibrations into nerve impulses. That single conversion initiates one of the most resource-intensive processing cascades the human body can perform. Compared to other primates, Homo sapiens sacrificed overall visual processing volume during our evolution. We allocated that cortical real estate to expand our auditory processing areas, deliberately strengthening their connections to the cerebellum and the prefrontal cortex. The prefrontal cortex is the brain region responsible for complex cognitive behavior, planning, and decision-making. Music operates as a highly complex multimodal stimulus. It forces the central nervous system to simultaneously decode the distinct mathematical properties of its driving melody, its layered harmony, its underlying rhythm, and acoustic timbre in real time. Managing this multi-dimensional processing demand requires the brain to synchronize vast, distributed networks. It demands the immediate integration of sensory input, motor execution, cognitive prediction, and emotional evaluation. The human sensitivity to complex tonal patterns and external rhythms developed as a biological survival tool. It evolved to facilitate social cohesion and predictive learning long before it became an aesthetic pursuit. Processing this density of information places severe cognitive demand on the brain. Sustaining that demand over time forces the central nervous system to adapt, creating measurable, dose-dependent changes in human neural hardware. These adaptations occur along three specific vectors. The first is morphological. Prolonged practice triggers physical increases in the structural volume and density of both gray and white matter. The second vector is physiological. Sound alters the dynamic electrical activity of the brain, specifically through neural entrainment and the active modulation of EEG frequency bands. The third vector is biochemical. Acoustic stimulation directly regulates the endocrine system, governing endogenous stress responses and dopamine-driven reward pathways. Tracking a single acoustic signal through these structural, electrical, and chemical pathways reveals the precise mechanisms sound uses to physically modify human neural hardware. After the auditory nerve converts the physical sound wave, the electrochemical signal hits the brainstem. From there, it disperses outward, flooding both the primary and secondary auditory cortices. The signal splits. The right superior temporal sulcus extracts pitch and melody, integrating complex auditory information. Rhythmic information bypasses this center. Instead, the brain routes tempo into a motor network, recruiting the supplementary motor area, cerebellum, and basal ganglia, which control habitual behaviors. This motor network activates entirely independent of physical movement. During passive listening, when a subject is sitting completely still, hearing a rhythmic beat forces the brain into an active state of physical readiness. Perceiving rhythm relies on intrinsic motor preparation. The human brain decodes tempo by physically preparing the body to move to it. To measure the long-term structural impact of this processing load, researchers use voxel-based morphometry. Voxel-based morphometry, or VBM, is a neuroimaging analysis technique that maps exact differences in local brain tissue concentrations. VBM scans of musicians who begin training early in life reveal severe structural hypertrophy of the corpus callosum. The corpus callosum is the massive bundle of nerve fibers that transfers data between the left and right hemispheres. Years of coordinating fast, bimanual movements thickens and myelinates this pathway, accelerating interhemispheric communication. This chart shows a gray matter density gradient. Heschel's gyrus reveals a perfect dose-response curve. Greater lifetime musical practice equals larger physical volume. This expansion also shifts to the cerebellum's anterior lobe, scaling to accommodate the precision required for rapid instrumental performance. Chronic musical training expands the anatomical hardware of the human brain. The computational demands of the stimulus dictate the physical structure of the cortex. Beyond anatomical changes, music dictates the immediate physiological dynamics of the nervous system by modulating EEG frequency bands. Electroencephalography, or EEG, is a method used to record and measure the brain's continuous electrical oscillations. The brain evaluates musical tension electrically. Consonant sounds reliably activate the orbitofrontal cortex, a prefrontal region involved in reward prediction. Conversely, dissonant chords recruit the amygdala, the brain's primary center for processing fearful and threatening stimuli. When an external rhythm is introduced, the human brain aligns its internal electrical oscillations to match the tempo. This phenomenon is called neural entrainment, and it allows clinicians to hijack the brain's electrical pacing. This line graph plots the efficacy of a standard transcranial magnetic stimulation pulse versus a pulse perfectly synchronized to a rhythmic sine wave. Transcranial magnetic stimulation, or TMS, is a non-invasive clinical procedure that uses magnetic fields to stimulate specific nerve cells. Stanford neuroscientists discovered that applying a TMS pulse immediately before the musical beat hits increases the stimulation's efficacy by 77%. The external rhythm organizes prefrontal and motor pathways ahead of time, creating precise, highly receptive windows of neural readiness that maximize the impact of clinical treatments. Music directly interacts with the mesocortical limbic system. Hearing a preferred piece of music triggers dopamine release in the striatum, specifically the nucleus accumbens, activating neurochemical reward pathways reserved for biological imperatives. Simultaneously, structured acoustic input downregulates the HPA axis. The hypothalamic pituitary adrenal axis is the body's central hormone-driven stress response system. Music actively suppresses the release of adrenocorticotropic hormone and circulating cortisol, dropping baseline physiological stress. The biochemical response varies significantly by genre. Data indicates that listening to classical compositions, specifically Mozart, markedly reduces systolic blood pressure by almost 5 millimeters of mercury, heavily suppresses cortisol levels, and raises alpha wave amplitude to induce cortical relaxation. Yet, clinical data from intensive care units presents a heavy metal paradox. Heavy metal induces intense cortical activation in sedated ICU patients, producing a stronger brain response than classical or atonal music. For listeners familiar with the genre, its complex rhythmic structure aids in the healthy processing of anger and builds emotional resilience. A predictable, soothing acoustic profile does not guarantee biochemical efficacy. The therapeutic impact of sound relies on high structural complexity paired with the individual patient's neurological familiarity with the genre. Because music recruits massive, heavily distributed neural networks simultaneously across multiple lobes, it functions as a robust neurological backdoor to reach damaged brain regions. In patients with Alzheimer's disease, memory circuits tied to music are remarkably resilient to neurofibrillary degeneration. Patients who can no longer recognize family members frequently retain the ability to sing complete lyrics from their youth, temporarily restoring speech and mood. In Parkinson's disease, the substantia nigra within the basal ganglia degrades. This cuts off internal motor timing, resulting in rigid gait and severe physical freezing. Rhythmic auditory stimulation creates a mechanical bypass. By feeding an external beat into the intact supplementary motor area and the cerebellum, the brain creates a detour around the damaged basal ganglia, reestablishing a steady pulse and restoring fluid locomotion to the patient. Applied music therapy operates as a structural engineering tool, utilizing intact secondary pathways to actively route around severe neurological damage. Active instrumental training demonstrates quantifiable preventative benefits during childhood brain development. Learning an instrument rigorously trains executive functions. Executive functions are the set of top-down cognitive processes required for goal-directed behavior, including focus, working memory, and self-control. A meta-analysis of 46 studies encompassing over 3,500 children established a global effect size of 0.350 for executive function improvements. The most massive gains appeared in inhibitory control, as adjusting rhythm and dynamics directly strengthens prefrontal self-regulation networks. This prolonged training creates neural efficiency. The optimized brain of a trained musician executes complex cognitive tasks with vastly less peripheral cortical activation, effectively conserving metabolic energy. The morphological volume increases and the neural efficiency generated by musical training establish a cognitive reserve. This physical reserve fortifies the brain, offering measurable protection against late-life cognitive decline and the onset of dementia. Music functions as a biological necessity. Driven by evolutionary survival, it acts as a mechanism designed to continually optimize and protect human neural architecture.